Diana. And we're back for number 10, adoption of an ordinance of the City of Yuba City imposing a ban on the establishment and operation of a needle, it says exchange here, needle exchange program within Yuba City.
Through the mayor, I need to recuse myself as I did the other
All
time.
right.
Thank you.
Thank you very much. We'll give you a couple seconds here.
All right. The California Department of Public Health is authorized by Health and Safety Code Section 121349 to approve a needle exchange program. CDBH has authorized Yuba Sutter harm reduction and community outreach to provide syringe services within Yuba and Sutter counties. The details related to the authorization are that it's effective May 11th, 2020 through May 11th, 2022, and may apply for renewal before the end of the 2-year period. Syringe services may be provided at the following locations. So Yuba County is at Harmony Health on Tuesdays and Thursdays from 5 to 7 p.m. A mobile location in Yuba County area bound by the Yuba River, F Street, and 2nd Street, extending as far west as 2nd Street on Mondays from 9 to 11 a.m. And then in Sutter County, the mobile location, an area bound by the 9800 block of 2nd Street in the area where 2nd Street and Levee Road merge, extending as far west as the Feather River Edge, Monday from 11:30 a.m. to 3 p.m. The ordinance was introduced to council on June 16th. The Sutter County Board of Supervisors adopted a similar ordinance on June 23rd. The proposed ordinance has the authority to enact and enforce ordinances, or the City Council has the authority to enact and enforce ordinances and regulations for the public peace, health, and welfare of the city and its residents. Absent a local regulation, a needle exchange program may be operated in virtually any location in the city. And so by adopting an ordinance, needle exchange programs will be classified as a public nuisance, and a ban will be imposed on the establishment and operation of such programs within the city. So as noted, the ordinance was introduced on June 16th, and the Sutter County Board of Supervisors adopted similar ordinance on June 23rd. So the recommendation is to adopt an ordinance of the City Council imposing a ban on the establishment and operation of needle exchange programs within Yuba City by adding Chapter 24 to Title V and waive the second reading.
All right. Shannon, I have a quick question for you.
Yes.
The verbiage here references needle exchange programs. The program that began this conversation is not, in fact, a needle exchange program. Would that be a legal issue if we specifically ban needle exchange program versus stating syringe services programs? Or are they interchangeable?
Let me check really quickly here. They should be interchangeable. This is the same ordinance that was passed by the county and syncs up with the county. But it is focused on a needle exchange program by its terms.
So if we pass this ordinance as worded, would we still capture the syringe services program that's proposed for the county, for our area here? Or will we have to do something, or just change our verbiage to encapsulate that as well?
It would be a safer approach to change our verbiage to capture that as well.
Okay. Thank you very much. Any other comments?
So Shannon, is the definition, if you look at CDPH's regulations, is the definition of a needle exchange program encompassing of syringe services?
You know, I just don't recall at this point. Let me look it up for you really quickly and I can get back to you. If you'd like to go to the next item, I can come back in maybe 5 minutes with the item.
I think we might have further comment anyway, Shannon, so we'll just do what you got to do. We really appreciate that, and we'll see if there's any comment from the public. We have one from Karen Hess, I believe.
Yes, we do. All right. She's recommending the adoption with conditions. I understand why you want to adopt this ordinance after viewing the June 16, 2020 meeting. In the packet for your June 16 meeting, I could not find any analysis that supports an increase in hazardous medical waste for your consideration. If I were on the council, I would expect staff to do the research or report the facts as they know them. Then I heard more than one of you who did your own research that led you to your conclusion. This is what staff is for. From what I heard, it sounds like the new program is not a needle exchange, but a needle giveaway. I read the state law. Did Dr. Liu or her designee approve this? You do know that state law was changed a few years ago, and these items can be obtained from a pharmacy without a prescription. So needle exchanges or giveaways are only needed for those who can afford to buy their drugs, but choose not to budget for needles and syringes. I do not want to waste your time by repeating the comments made by the public at the June 16 meeting or present other facts, opinions at this time. Therefore, I ask the City Council of Yuba City to do the following. Approve the ordinance for 1-year duration, draft and approve a resolution declaring that the City of Yuba City desires a workable plan to reduce IV drug use and its spread of communicable diseases, desires CDPH and the local agency and its partners to develop and publish enforceable protocols to ensure that this is an exchange and not a giveaway, and give them a time limit to respond. Require approval of the program by local public health in accordance with the law. Schedule a review for 2021 and possible extension of the ordinance based on the evidence. I believe this is a compromise that will satisfy all parties involved and put the onus on the program to meet the needs of the community and develop a program that will be accepted.
Okay, thank you. Confirming no others?
Yes, that's confirmed.
Okay. Commentary, Vice Mayor? So you don't have anything yet in the interim? Okay. Well, we can't bring Grace back because she is still sequestered. I will just take the opportunity to say that I'm still in favor of the ban, however we end up having to word it. Attended a good meeting over in Yuba County involving several individuals, some of which were from Chico City Council, who are highly recommended that we don't proceed based on their experience in a similar program. A citizen came forth, a mother and a local community, a gal who's very active in the community, identified some of the behaviors of the program, ran up there. Also regarding needle exchange, not exchange, but syringe disposal services. Some of the commentary that I've heard and read, they would lead people to believe that this type of a program is necessary in order for people to receive services and properly dispose of syringes. That's, in my opinion, not true. People can offer services and do outreach to people who suffer from substance addiction without having to exchange or give them needles. I do believe it's probably a way to get some of the needles off the street because they give them the sharps containers, but there's other ways, I think, to do that without placing the safety of our community and in particular our children at risk. Not to mention the fact if you might have a sterile needle, but what about that heroin you're injecting into your arm? I guarantee that's not sterile. So you're defeating your own purpose also. So that's a little bit of my 2 cents on the issue. Shannon, how are you progressing?
Thank you, Mr. Mayor. I've taken a look at this. I don't see a definition of a needle exchange program in the Health and Safety Code sections 12, 13, 49 at Sequentia.
Okay.
That would be the sections that would regulate needle exchanges and clean needles and the process for doing that.
Okay.
I'm flipping through the last of it right now, but it appears to me that just using needle exchange program as it's currently in the ordinance and consistent with the county would apply to any needle exchange programs done under the Health and Safety Code, sections 12, 13, 49, as sequential. So to the extent that this particular project or a project that may have been raised falls within the ambit, then it would be subject to this particular restriction.
Okay, so we're good as we stand then, in your opinion, is what you're saying?
Yes.
Okay.
If they are proceeding under 12, 13, 49 at sequentia, this would cover them.
Okay. All right, thank you very much. So we're at a point now where, adopt the ordinance.
Through the mayor,
Sir?
I move that we adopt an ordinance of the City Council of the City of Yuba City imposing a ban on the establishment and operation of needle exchange programs within Yuba City by adding Chapter 24 to Title 5 and waive the second reading.
Second.
First and a second by Councilmember Cardoza to adopt the ordinance. All those in favor signify by saying aye, please.
Aye.
Aye.
Aye. And opposed? None. Thank you very much.
Through the mayor.
Yes, sir.
Just to be clear, I have not verified whether a particular program or community program would fall underneath 12, 13, 49. I'm just assuming that they are. I don't have that information.
Okay, would it be a problem? I mean, that is definitely our intent, is to prohibit these types of activities going on in our city. Is it a problem later to amend, or do we need to come back, or if we do
We could come back with another ordinance if we needed to, and I suggest that if you were inclined to do so, you would sync up with the county as well and do it in conjunction with them.
Okay,
I would like to note that attachment 1 to the staff report has the letter from CDPH where it notes that this program is has met the requirements of California Health and Safety Code section 121349.
okay, so we do
Qualified.
fall under.
Yes, for authorization.
That's good news. Thank you very much. All right, and
Thank you, Diana.
thank you.